Hello, I'm Susan Dentzer, Senior Policy Advisor to the Robert Wood Johnson Foundation, and my colleagues and I want to welcome you to this First Friday on Health Google Hangout. First Fridays are a series of briefings held on the first Friday of the month, like this one, to help friends and grantees of the Robert Wood Johnson Foundation stay informed about Foundation priorities and activities. Today, our topic is building a culture of health by tackling health improvement and health equity in the nation's communities, and by doing that with the assistance of the county health rankings and roadmaps. The rankings and roadmaps are a result of a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. That partnership is now 6 years old, and over the course of that time, we've assembled the county health rankings to offer data, tools, and resources to arm communities with the information and strategies they need to understand, first of all, the fundamental drivers of health in communities, and then, of course, work to correct those drivers that lead to poor health. As we will hear in just a few moments, the 2015 county health rankings were just released last month, and they show that counties across the country really are availing themselves of these tools and these guideposts to make real progress. We hope that you will tweet us your questions after our speakers speak today at hashtag RWJF 1ST, as in first, 1ST Fry, and of course you see that also on your screen. We do have three terrific speakers to tell us about the county health rankings and roadmaps today and how they've made use of them in many instances. First of all, we're happy to have with us Julie Willems Van Dyke, who's Associate Scientist at the University of Wisconsin Population Health Institute and also co-director of the County Health Rankings and Roadmaps program. We're also very happy to have with us Paul Vest, who's President and CEO of the YMCA of Western North Carolina, which is one of the roughly 70 organizations participating in efforts to improve health in Asheville, North Carolina, and surrounding Buncombe County. That stakeholder collaborative was one of the 5 winners of the 2014 RWJ Culture of Health Prize given out by the foundation last June in 2014. We're also very happy to have with us Renee Kennedy, who's CEO of the Michigan Public Health Institute and Assistant Professor in the College of Human Medicine in the Program for Public Health at Michigan State University. She's also a member of the Scientific Advisory Group, which advises the County Health Rankings and Roadmaps program on many of the scientific and technical issues inherent in the program. We're going to start first today with Julie, and Julie, give us, if you would, an overview of the Rankings and Roadmaps program and summarize for us some of the highlights of the 2015 rankings.
Thank you, Susan, and welcome to all our viewers across the nation. As most of you know, last week, as Susan said, was the release of the 2015 County Health Rankings. And what the rankings serve is an annual checkup of the health of nearly every county in the United States. What they have been able to do over the last few years is really broaden the conversation about health beyond just simply what happens in the doctor's office or in a local hospital, but to really help people across the community explore and think about the many factors that influence health. Everything from creating environments that make it easy to make healthy choices to important social and economic factors, such as how can we tackle child poverty? How do we look at income inequality, a measure that I know Renee will be speaking to further in a few minutes? How do we think about improving educational outcomes or connection between people and communities? All of these drivers are very important in terms of improving health in the community. Now, many times we're asked why we produce this report every year, and we do because, number one, it helps communities stop, pause, take the pulse of their community and see how they're doing, and secondly, it provides opportunities like this for us all to re-engage in the conversation about what creates health. This year, after 6 years of producing the rankings, we had an opportunity to look at the data over the last 6 years and think about that question, how are we doing? And we've looked at counties that had a population greater than 65,000, and we found really encouraging news. And that was, in those counties, we saw 60% of them were seeing reductions in their rates of premature death. That's really encouraging to know that over the last 6 years we've seen that kind of progress. However, it also means 40% were not making progress, and we also know even in those 60% that were, there's room for even more progress. So another element that the county health rankings share with us each this year is this call to action for people to come together in communities and look at their data, and then look to the County Health Rankings and Roadmaps program to see where there are tools and resources to guide their work to move forward. And we're seeing it happen. We've seen businesses like GlaxoSmithKline use the rankings model as a framework for how they do corporate giving in communities where they have a significant presence. We've seen other foundations like the Clinton Foundation, like the Kate B. Reynolds Charitable Trust, use the County Health Rankings model data tools to guide their philanthropy and their grant making in their community. And we've seen local communities throughout the nation bring people together from across sectors to say, what can we do to make health better here? And you're going to hear from some of those incredible people here in just a few moments. So I'm excited to be here. I encourage people throughout the Hangout and the rest of the day and weeks ahead to visit countyhealthrankings.org, take a look at your county's data, and also don't miss the roadmaps portion of the website where you can find tools and guidance to drive that action in your own community.
Thanks so much, Julie. Well, as Julie said, a lot of communities are availing themselves of these tools, and one of them that did that so was the Stakeholder Collaborative in Buncombe County. So Paul, turning to you now, tell us about how the collaborative made use of the rankings and roadmaps, and even more important, tell us what has happened in the community as the stakeholders have come together to address the status of health in Buncombe County.
Sure. Thanks, Susan. It's good to be part of this group, and I appreciate the invitation. This has been a very interesting journey for us, and I think one of the things that the health rankings have helped us do is bring some common language to the discussion. We have, the YMCA was part of an initiative years ago called Pioneering Healthier Communities, and we were very successful with that, but found some real gaps in our ability to connect with all folks in the community that really needed to be around our table. It was at that point in time where we had more discussion with Buncombe County, who was already doing a great job with looking at health assessments in the community and what that meant for our community as a whole. And when we started really looking at the health rankings, I think that created a whole different dialogue. We were able to bring folks together in partnership that were doing some of the great work addressing some of these issues together around the table. Our Public Health Advisory Council was formed that really brought folks from all across the county to the table. And so the work that happened with those health rankings, I think, really brought some common language. What we did see was a greater commitment in conversations. There's a number of different partners throughout the community, the YM, YW, the Chamber of Commerce, the United Way. There's a number of folks who have interests in these areas, but what this ended up doing was creating a real good conversation piece for our partners that put the language at a place that allowed us to find those common threads in the fabric of the work that we wanted to do in the community, and was really helpful in that process. And then finally, I think one of the things that we have found some success in, and partly because of the Robert Wood Johnson Foundation Culture of Health Prize that we did receive last year, was really taking some time to look at the bright spots of our work. We did find out and recognize that there's a lot of great things going on in the community. There was an important part of how do we connect those with our work so that people did feel part of a bigger cause in the work that we did. So the Health Prize was really a great opportunity for us to collectively come together, look at our success, look at the things that we're doing well, and then be able to focus on the things that we knew we needed to change.
And just to follow up briefly on that, Paul, I know that the council has had a role in a lot of the positive changes in the community, helping physicians and others work to address obesity and asthma in the community, among other things. You've taken some steps to advocate on behalf of having adequate child care for people in the community to support their ability to work and earn incomes. What would you say are some of the key highlights of the advancements in strategies to improve health?
Well, I think a big part of our work has been around looking at the issues around children, in particular, children in poverty. But a spin-off of that has been recognizing that so much of what happens in our communities does impact health. So looking at wages, the simplicity of the access to EBT cards around our food and markets, tailgate markets in the community. We've got great opportunities around fresh fruits and vegetables, but making sure that folks have access to that. And so doing some of this work has really elevated some awareness. I think one of the things that we've really looked at is that child poverty piece, and everybody seems to be able to get around that and really try to tackle that in a pretty progressive way.
Well, that's a great segue to you, Renee, and your interest in child poverty and income inequality in particular, both in your work at the Public Health Institute and your work in connection with the scientific advisory group to the county health rankings and roadmaps. How should we view this question of income inequality and its relationship to health in the community?
Well, you're right. It is a perfect segue, and as with my colleagues, I'm thrilled to join you guys today. You know, we were very intentional, I think, in the scientific advisory group of thinking about how to make the dialogue around child poverty more robust. And so this is the first year that we've included income inequality as a measure to continue to inform the dialogue, the thinking, the policy making, the intervention development of communities. You know, I must share that yesterday I drove from Lansing, where I live, to Grand Rapids, Michigan, to go hear a lecture between Dr. Cornel West and Dr. Robert George. Very progressive thinkers of our day, and I was struck at how frequently the issue of income inequality came up in their remarks, and wealth inequality, and what it meant for the potential of our society to be well and to be whole. And I'm really appreciative of that tenor, not just because of the county health rankings, but due to, I think, in many cases, the contribution that there are many sectors talking about this. You know, as I was driving back, I had the challenge of trying to listen to my GPS, and it was dark, and figuring out where I was going, and I made one turn that landed me in a lived experience of what income inequality was all about. A community that was nothing like the beauty of the university that I had just left, with its august facilities and resources. And I couldn't help but reflect as I kind of drove through this community trying to find my way, that what must their income be, and what must their lack of income be doing to the overall well-being of this city and of this county. And I think that all of us could probably have the same experience in our own communities, but we often take those disparities for granted. Yes, this is that side of the railroad tracks, and this is the other. So we want communities to think very clearly about the comparison between sort of the top sector of income, the lower sector of income, and not just what those differences are, but to develop an understanding that as goes that difference between, dare I say, the haves and the have-not, goes the well-being of the overall community. This is a collective measure. Even if you reflect on, and probably this is because I just heard Dr. George and Dr. West, but if you think about our preamble of our Constitution, we have all types of collective terms in there. We, the people, a more perfect union, establishing justice, a common defense, a general welfare, all of that is about our collective well-being. And we are learning increasingly that certainly individual income has an impact on someone's health and well-being. Certainly individuals with poorer health have less ability and less access to economic potential. But now to challenge ourselves, that it is both about how well we are doing and how poorly we are doing as a community that makes a difference in our overall health and well-being. So I agree fully with our RWJ colleague, Dr. Don Schwartz, who said, you know, for the first time, it's just looking at his quote, this also provides a county with a measure that looks at the gaps between wealthier and poorer populations, and to recognize that the entire community suffers when inequality reigns, as he says. And so we are committed to the understanding and extending the understanding that inequality is hazardous to our health, just as childhood poverty is, just as children living in single-parent households may be, just as social association and the other socioeconomic measures within the county rankings. But we think this, particularly this year, sets us on a trajectory of a much more robust and profound dialogue, but also decision-making.
Well, thank you, Renee, and thanks to all three of you. So just briefly to recap what we've heard, as we heard from Julie, the rankings really do represent an opportunity for a community to come together and do a checkup, take its own pulse, if I think was the phrase you used, Julie, and use it to broaden the conversation in the community about what really is driving the health or poor health of the community. And as you mentioned, clearly a number of communities are doing that and taking steps to improve health, and that probably helped to result in the statistic you mentioned with looking at those counties with more than 65,000 people in them. You saw a 60% reduction in the premature death rate, that of course being the death rate before age 75. So obviously the conversation is well underway in many communities and has led to some action. You pointed out that 40% aren't making those improvements, and that's where some continued attention is going to have to be directed. We heard from Paul that Buncombe County was launched on precisely that set of conversations and journey, and that the rankings had the value of affording a common language for all the stakeholders around the table to begin to come together and address aspects of health in the community through the Public Health Advisory Council that was formed. And thank you, Paul, for sharing with us the work that you've done, particularly in the area of children in poverty. Some real bright spots, as you said, in the community that have resulted as you all have come together to work in that arena. And then finally, just from Renee, I love the phrase, inequality is hazardous to our health. That really sums up your fundamental point that the differences in income in the community obviously result in differential health status among people in the community, but more broadly, they affect the overall well-being and the overall health of the community, and that is obviously an extremely important consideration as we look to improve health and address what's going on in those 40% of large counties that are not making progress. So with that, let's go back and drill down a little bit more on the 2015 rankings. Julie, we know that the rankings illustrate that rates of poverty are more than twice as high in the unhealthiest counties in each state compared to the healthiest ones. The unemployment rates are 1.5 times higher in the least healthy counties as in the healthiest ones. And the healthiest counties also have higher college attendance rates, among other things. So as communities think about coming together to address these phenomena, what do you see counties doing now that is constructive in attacking all of those things? And what lessons do the successes of some of the counties offer for other counties that have not made so much progress?
Great, Susan. As I said earlier, there are so many places who have taken this bull by the horns and said, we're going to work on improving health. Let me share with you an example from another one of our RWJF Culture of Health Prize communities, Spokane, Washington, where, again, colleagues from across the community, business leaders, public health leaders, healthcare leaders, school leaders, came together did an assessment of their community, and together, through a process called Priority Spokane, identified a terrible rate of high school graduation as their community's primary issue that they wanted to work on. Only approximately 60% of children were graduating on time from their local high schools. And so this group looked at data, analyzed, thought about who is it that is dropping out and where can we intervene earlier in children's lives. They recognized that attendance was very important, and so they put a robust data system together to monitor attendance and support children who were missing school in middle school and elementary school, so getting at the problem at its root cause. And they also expanded job training opportunities within their K-12 system to focus more on science, technology, engineering, and math, where they knew employers in their community were saying, we're desperate for employees in a workforce that's educated in these areas. This met the needs of employers. It also then starts to target that important issue of income inequality by helping children become prepared to be workers in industry where they're going to make good paying wages that will start to combat some of those issues. So a really good example in Spokane. I'll give you one other quick one. In other prize-winning communities, Brownsville, Texas, and Williamson, West Virginia. Williamson, a very small place in the Appalachian Mountains, coal mining country of West Virginia. Brownsville on the border of our nation with Mexico. They have used the whole concept of community gardens as a way not only to add healthy food into their community, but as a way for people to nurture their garden and harvest food and be able to sell that food as a supplement to their household income. So it's an entrepreneurial activity as well as a healthy eating activity. And in both those places, also a place where they've built social connection and people from different generations working together to really enhance that social fabric of their community. So just a couple of examples where we see communities coming together to really think about how can we move income forward.
That's great. Thank you, Julie. So, Paul, I know in Buncombe County, generally, as you mentioned earlier, the concern about child poverty has led to concern about adequacy of child care subsidies, in particular to assist parents who are working. And you've had at least some success dealing with that issue in the county. You've also, in Buncombe County, had in place a living wage law that applied at least to city workers. How able have all of you been to advocate more broadly on some of those issues beyond the boundaries of the county at the state level in North Carolina at the moment?
Well, it's interesting because I think we are challenged somewhat geographically because of where we sit in the state compared to where Raleigh is. But I will say that, again, going back to my comments around the common language, we are seeing, I think, instead of individual nonprofits and groups trying to address these issues individually, a real effort to make sure we do have a common voice. So we are, our group is spending a lot of time talking about the importance of public policy and what are the right ways that we as a collective voice need to be dealing with that, both at the local level but also in Raleigh. We are challenged greatly right now with some of the things going on around child care subsidies. So that issue is coming back again where we're seeing some drawbacks of funds, and we're seeing kids now that are being forced to go home by themselves. But collectively as a community, there's a lot of conversation that's being had, and how do we address that with, again, that common voice. So this work, again, you know, we tend to look at it from the WISE perspective of nutrition and exercise. But the more we peel back these issues in the community as an organization, we certainly get more and more engaged in looking at things that are affecting our children in particular, or our families, outside of just exercise and nutrition. So it helps us get engaged more deeply as a local and national organization, but at the same time I think it does create that opportunity with one voice to really start making a difference well, we're hoping that we will start seeing some of those changes here in the coming months.
And Renee, I know that you look not just at the question of income inequality, but top other factors that go into the county health rankings that also have an influence on health that matter a lot, like the level of social associations within a community. We know social isolation, especially of vulnerable populations, can be a big contributor to ill health. Help us put factors like that into context, particularly as we also think about the connection with income inequality and some of the other drivers of poor health.
Well, I think Paul just made a critically important point that we're beginning to understand that health is not just about how many vegetables we eat and how much sleep we get and are we exercising and are we going to our regular doctor's office, but all of us. I mean, almost every industry or discipline really is a health worker, whether it's about public safety, whether it's about employment, whether it's about education. Ultimately, we're beginning to see increasingly scientifically rigorous studies that link those things to health and well-being. We recognize that we are social beings, and certainly as a sociologist, right, I'm a big advocate of that, but we see that when people are connected in relationships that are affirming and constructive, it contributes to their overall health and ultimately serves as a measure for health of the community. Social associations means that there are greater opportunities for people to connect, for people to volunteer, for people to vote. Civic engagement is about health, and social cohesion is about health.
And I love, once again, you've come up with a terrific phrase, the notion that health workers are us. All disciplines, in effect, can think of themselves as contributing in some way, and possibly some very important way, to health. Julie, I want to go back to you and talk a bit about the coaching opportunities that are afforded communities through the county health rankings and roadmaps programs. Would you tell us a little bit about those coaching opportunities, and perhaps again you have some examples of communities that have been coached to take the factors and the rankings into account and make some important changes in their communities?
Great. Well, Susan, we are so happy that we have this service to offer local leaders and communities across the nation. When the University of Wisconsin Population Health Institute, in collaboration with the Robert Wood Johnson Foundation, published the rankings for the first time in 2010, we were all frankly amazed with the response. And not only that the media covered the rankings, but the community said, all right, we have it. We aren't as good as we want to be, and we want to do better. And literally, our phones were ringing off the hook here in Wisconsin, and I know in Princeton, New Jersey at the foundation. And so we were very grateful that the foundation invested in thinking about not just where is this data, but where are the tools and resources to put action, to assist communities who want to take action to move forward. So, as I mentioned earlier, there is a robust set of tools and guidance around the process for improving health at the Roadmaps to Health Action Center at countyhealthrankings.org. There's an incredible resource called What Works for Health, where we've basically reviewed all of the different health factor areas in the rankings and show communities what policies and programs have evidence and provide guidance on how to implement those. But we also knew that a website only goes so far, and that you can get stuck moving from screen to screen to screen, and that human interaction and problem solving is really important. And so again, with the gracious support of the foundation, we've been able to build a team. It has grown over the last few years to now include 11 coaches. And our coaches are located not only here in Madison, Wisconsin, but in locations across the nation, so that they are in tune to what are some of the regional and cultural differences in our communities. Anybody can request the assistance of a coach. There are many little orange buttons on the website that say need help, contact us, and if you click on that, You'll be directed to a form where you can tell us what you would like to do with a coach, what kind of questions you have that a coach could assist you with. And it can range from as simple as an email exchange or a few phone calls to if you have a team in your community with a very specific issue that you want to work on over a 6 to 12 month period of time, you can apply for more intensive coaching. It's a simple application form, and we'll link that coach who will work on a regular basis, monthly basis, virtually using this kind of technology. We actually use Google Hangout with our coaching communities and help them work through the strategies and the processes to move health forward. We've heard from communities across the nation who have availed themselves of that what the coaches have helped them do is what Paul mentioned earlier, is really help build that common language, take a problem that was this big and focus in on where they can actually start to implement strategies. For example, we had a community that said we want to reduce obesity, and when they started to really hone in and see what the issues were within their community, they discovered food insecurity was a huge issue. Access to healthy foods was an issue because when you're food insecure, you're buying cheap fast food or processed food, and so they've been looking at how they can expand community gardens, work with their food banks, look at root causes about how to help people get access to healthier food and adequate food. And so one little example of how a really big problem got honed in to a place people could actually take action.
Well, Paul, that takes us back to you and Buncombe County. It does seem that when counties and communities reflect on these fundamental drivers of health, they often find it's similar sets of issues from one community to another. What do you think are the opportunities now for communities to really learn from each other and learn from each other's examples, finding that across the board, particularly when there are areas of income differential, of course there's going to be differential access to healthy food, most likely within those communities. What do you think are the real opportunities now for communities to learn from each other as they try to improve health?
Well, I think ideally and realistically, our communities have to get to the same table with each other. Western North Carolina is an incredibly rich area with huge assets environmentally, with the beautiful mountains here, and what we find sometimes is that geographical divide sometimes keeps us from coming together. And I think community leaders have got to be willing to put their interests aside and look at the region as a whole. We know in this area in particular, in Buncombe County, we drive a lot of the business, and so there's a lot of folks who come in from outside this immediate area to come to our community. If we want to have those lasting effects, we have to go beyond our Buncombe County in particular. So as we reach out to some of our other areas that the Y serves, for example, we're recognizing that some of the issues that we may be dealing with in Buncombe County may be the same issues in some of these other counties, but have to be looked at differently because it's addressing different folks from different walks of life. So as far as we're concerned, this is about, again, coming to the table, putting some of these silos aside, sitting down and really looking at a healthier community does create a healthier economic opportunity for our communities, as well as an opportunity to feed all people in our community and region to make sure that we are raising healthy kids and we are looking at the assets that allow us to do the kind of work that we should be doing.
And you've brought up a very important point, which is assets. No county has none in the way of assets. Every county, presumably, every community has strengths that they can build on. I'm wondering, to take that back to Renee now, what would you say would be an example of a community looking at a set of strengths and using it to address, say, issues like child poverty in the community, or areas where there is a poor track record of social association, or areas where there really are substantial disparities in income?
Well, I think the question is really important, and more important the county health rankings are the springboard. This is not one size fits all. We present a summary report. As Julie said, here's our annual checkup, and then it requires communities drilling in. The county health rankings allow people to look at the data across gender, across class, across race. In my own community here in Ingham County, there was great concern about male involvement. There are a couple of different initiatives happening in our county that are driven by data such as are described and obtained through the county health rankings. And so a community came together, and instead of saying, well, isn't this bad? It seems like Black men are not as closely engaged, or there are these barriers for Black men coming together. They sought funding. Their Healthy Start initiative here at the Ingham County Health Department now has set priorities for father involvement across race, but with greatest emphasis among those families where we see the inequities and the disparities. We have My Lansing, which is an arm of My Brother's Keeper, doing a community engagement around boys of color, engaging them actively so that, again, it's not one size fits all. There are all types of different benefits that come along with employment. Again, you get social cohesion from that. When you have a father actively engaged, you have a higher household income. So all of these social and economic variables link to one another, and we are trying to set really a venue for communities to roll up their sleeve, click and guide their way through the data, call when they need help, so that they can determine what are the solutions to best resolve the problems in their jurisdiction.
And I know that across the country we see examples of communities that have taken stock both of their assets and their deficits, and building on the assets, able to introduce some strategies to improve health. I know in the Seattle region, for example, when a stakeholder group looked at this, they saw one of the great resources in that part of the Northwest is, of course, access to water and recreation, and that helped to lead to a program that encouraged minorities, and particularly minority children who were swimming at lower rates, lacking access to swimming lessons and those kinds of things. They were able to create opportunities to engage children more actively in recreation, in swimming, in public pools, and therefore help address the rather high child obesity rate in the community as a consequence. So back to you, Julie. It sounds like we across the country could catalog a number of examples of counties spending as much time building on their strengths as they are taking account of their deficits in order to improve health. Is that right?
Absolutely. And Susan, another resource of the County Health Rankings and Roadmaps is on our website. We have a number of examples of communities who are doing just that, have looked at the data and have said, we can do this, and we can do this by looking at where we're strong first and building on that to then address areas where we need to make improvement. You know, I want to return back to the income inequality measure for just a moment, because I think it's a good example of this as well, too. This measure is the first time in the measures within the county health rankings that we've had a measure that looks at gaps within a county. So as Renee was describing earlier, the income inequality measure looks at the comparison of households at the 80th percentile of income to those at the 20th percentile of income. And this is an important measure in all communities, but particularly a point to look at for those communities who are ranking very well in your state. Because many times, if you're in the top tier of counties within your state, you may have an income inequality measure that would give you pause and say there's a great divide between the wealthiest and the poorest in our community. And that can be a real opportunity for a community that has many assets to say, what is that costing our community in terms of social cohesion, that Renee is talking about in terms of economic opportunity for all that Paul was talking about. And what can we do to bridge that divide between wealthiest and poorest to make sure that health is available for everyone in our community? So a real opportunity, I think, with this new measure for some of the healthiest places to perhaps have a wake-up call and say, we shouldn't just rest on our laurels, but there's more we can do.
I know when we had this discussion last year, we were featuring Santa Cruz County, California, which where some very important work was done to advance the economic interests of the community as a means of addressing health. But it also helped the community recognize that there were probably healthier ways to do that than others. And specifically in Santa Cruz County, as the county noticed an uptick in the alcohol use rate, they were able to rejigger a plan to create a new bar district, an entertainment district in one of the cities in the county, into something that was a little bit more family-friendly, entertainment-oriented. Still get the benefits of a new set of enterprises in the community, but ones that were probably better disposed to health. Paul, I'm wondering if there are examples like that that you're familiar with, either in Buncombe County or elsewhere, where those around the table have essentially looked at the imperative to increase economic activity, but also wanted to do that in a way that maximized the health of the community. Has that been an issue in Buncombe County?
Yeah, I think a while back we spent some time really looking at the walkability of our community. There's some studies that were done. I know the city downtown did some work around simple things about looking at crosswalks and how people are crossing streets, where they're crossing streets, the timing of how the lights are moving, that allow people to walk our city. It's a very walkable city. It's a vibrant city. So taking those kinds of steps of recognizing that an active, alive city is great for the economy. I'll say this as well. It's very exciting to see some efforts here in Buncombe County around our riverfront, redevelopment of our riverfront. The county's done a great job of looking at our trailways and making sure that there's some connection there. I'm not sure 5 years ago even we would have been having these kinds of conversations, because I do think the conversation has been about the walkability and how do we get folks moving without necessarily getting in cars, and the safety of our streets. I mean, we have a number of folks who use our public transportation, but if they have a hard time getting from their neighborhood to a bus stop, it really defeats the purpose. So there's a lot of good things that are beginning to happen, and I think it continues to be a spin-off of our health rankings and being able to look at the kind of things that we want to make sure we're measuring.
Well, as we near the end of our time together, it's worth coming back to just underscore a few more points that we brought to bear on today's discussion. First of all, as all of you have stressed, the importance of public policy building in a positive direction off of some of the information contained in the county health rankings and roadmaps, really recognizing that all of us in our own way can be health workers, and we need to think about all disciplines working to contribute to health, that the communities have a lot of opportunity to build on their strengths and build on their assets in improving health, and also there's a way to fine-tune economic development strategies in particular to maximize health. So all very important points that all of you have made in the last few minutes. As we, again, as we move to close, I'd like to ask each of you to address a final question briefly, which is, if I were sitting in a community or a county that hasn't yet gotten started on the voyage that you all described, the journey of recognizing the health status of the community and improving health, what's the most important first step in your view for a county that wants to come to grips with this? And Renee, I'm going to start with you.
Wow, I like to talk about kind of a pool, and it doesn't matter which side you jump in on, just as long as we land in there. There are so many opportunities, and we've used a word repeatedly during this time, and that is leadership. And I want to underscore that leadership doesn't necessarily look like each of us. Leadership is that woman who wants to walk to work or roll the stroller in the afternoon and the community is structured in a way that doesn't allow for it. That father who wants to be connected to his family, and various policies and practices preclude that. So leadership comes from the community. Many of the things that we've done in my own community have been driven by community partners coming to public comment at commissioner meetings, or calling the health department and talking to a staff person, or going to the YMCA and saying, we need more of this. So leadership is vitally important. The other thing I would challenge is for us to think not just about differences, the inequalities that are described. The county health rankings presents the what, but it is up to the communities to then orchestrate and unpack the why, the inequities of why are incomes unequal in their community, or why are different sectors of their community experiencing different outcomes. And we hope they'll be challenged enough to speak up, and one voice adds to a second and a third and a fourth.
Great, thank you. So Paul, briefly to you, if a county wants to get going, what's the most logical first step for it to take?
Well, I agree with Renee 100%. I think starting the conversation is critically important, but also as you move through that conversation, constantly asking the question, who's not sitting around the table that needs to have a voice at the table? We need to be about inviting folks who, unfortunately over time, have been quieted, and need to make sure that they understand that they are welcome to come to the table, that they have an opinion that needs to be valued and shared. And I think the more we get folks engaged and involved and bought into this work, it becomes the work of the community, and not just a group specifically looking at one item or another, but really a global effort to make our communities healthier. So I think that dialogue has to start, and we have to be talking about who's missing at the table all the time.
And Julie, last word to you. In addition to communities taking the first step of going on the County Health Rankings website, countyhealthrankings.org, what else should communities that want to get going do first?
Well, I would echo what my fellow panelists have said and say, invite someone else to come along the journey. People are waiting. They want to make their community healthier. And oftentimes, by just saying to someone, let's get together and think about what we can do about this. Let's get together and go visit a business leader or our city council member or our school superintendent. Important voices will come forward to move the health of the community.
Well, we've heard from several very important voices today, and I want to thank our Hangout participants, Julie Willems Van Dyke of the University of Wisconsin Population Health Institute and co-director of the County Health Rankings and Roadmaps program, Paul Vest from the Y in Buncombe County, North Carolina, and Renee Kennedy from the Michigan Public Health Institute. Thanks to all three of you for a terrific discussion. I want to thank all of you who've joined us on this Hangout today, and I hope you'll join us again next month on the first Friday of May, May 1st, when we'll be discussing findings that emerged from our recent second National Summit on Transparency and Healthcare Cost, Prices, and Quality, a summit that we held here in Washington, D.C. in March. We'll have a terrific discussion as well based on what came out of our deliberations about transparency in those areas of health and healthcare, and hope you'll be able to join us for that discussion as well. Thanks to all of you again for joining us. We hope you'll sign on to future First Friday broadcasts, and have a great day.
Thank you, Susan.